some of us, although we would have loved to be there, but because of the current global pandemic, we couldn't join you physically. And this pandemic has claimed the lives of over 1.9 million people as of today, which is a terrible thing to humanity. It's indeed a great tragedy. But I have, please, the next slide. I have some good news for us, some not so good news for us, and also I would like to also have more good news for us. So I'll start with the good news. And here's the good news. Regardless, or I would say in spite of the current global pandemic, which is COVID-19, and the tragedy that it is causing all around the world, if you look at the data, at least based on what we have been provided from the World Health Organization in the global health statistics of the recent year, 2019, we can see that diseases like COVID-19 are not having the edge. They are not winning. As a matter of fact, if we look at the list of the 10 top causes of mortality, the 10 top causes of mortality in the year 2019, we can see that on that list, non-infectious diseases, or rather infectious diseases like COVID-19, are not the most prominent on the list of the top 10 diseases that are plaguing humanity. As a matter of fact, if we look at that list, we realize that diseases like TB, tuberculosis, and HIV are no longer on that list, which is good news for us. And the good news is that at least that encourages us that COVID will not have the upper hand in this situation, because the trend, the general trend, shows that sciences and the endeavors of research scientists are making it easier for us to tackle infectious conditions. However, that should not stop us from also taking notice of the other diseases that are plaguing mankind. And in this case, there's something remarkable, which is the fact that non-communicable diseases have been persistent for over 20 years as the top cause of death for over 2 decades. And that is even more remarkable in the fact that just in the last year, that's in 2019, not 2020, for the first time, diabetes was able to make it in the list of top 10 killers. That's what I call that list, top 10 killers of mankind. It's not only diabetes, but we also have Alzheimer's for the first time. Alzheimer's was able to join that list of top 10 killers. So even though infectious and communicable diseases are killing a huge number of people, we must not lose sight of the fact that even recently, as of 2019, the number 1 cause of death on earth are not communicable diseases. Rather, they are non-communicable diseases, such as cardiovascular diseases, such as diabetes, such as Alzheimer's disease. So research efforts have to take cognizance of this. And the question that we ask ourselves is, how do we approach these non-communicable diseases? These diseases that you don't get infected by coming in contact with somebody who already has it. How do we tackle these diseases? How do we tackle diseases such as cardiovascular diseases, such as cancer, such as diabetes? How do we approach them? So I would propose that we need a multifaceted approach against these diseases. because there's no magic bullet that we can apply to challenge these conditions. We need a Swiss knife approach whereby we attack these conditions from different perspectives. And given that, the question that arises is there a role for bioactive enriched extracts? Is there any role for traditional medicine in combating these non-communicable diseases? And that is what I'll be focusing on in this talk this morning. Please, the next slide. So, if we look at the slide in front of us, we have type 2 diabetes, we have Alzheimer's disease, we have Parkinson's disease, and we also have a rare disease which is called transthyretin amyloidosis. I know a lot of people have not heard of this, but you'll be hearing more of it this morning. So what is common among these 4 diseases? Diabetes, Alzheimer's, Parkinson, and transthyretin amyloidosis. The first thing is that they are all non-communicable diseases. They can be transmitted like COVID. And they are chronic conditions that develop over a series of time. And as they develop, they become more degenerative. And these diseases have no cure. These are just at the facial level. None of these diseases can be cured. Once these diseases set in a particular individual, then the clock of death starts ticking. Now, at the molecular level, we realize that all these diseases have something in common. In their molecular etiopathogenesis, the way that these diseases come to be, they share a key process in their origin. And that key process is that there is a particular protein that gets misfolded and or aggregates. And once that protein becomes misfolded and aggregates, it transforms from a normal protein into a toxic protein that then starts the pathological process, which then leads to the sickness and the symptoms, and ultimately, in every single one of these, it leads to death. So, please, the next slide. In the case of transthyretin amyloidosis, I will want to use these 4 diseases as to instantiate whether medicinal plants and bioactive enriched extract could have a role in tackling these 4 deadly diseases, because that's what they are. So in the case of transthyretin amyloidosis, just from the name transthyretin is a protein that is produced by the liver. If you look at this pathway, it is released, it is synthesized and released from the liver into the systemic circulation. Under normal physiological circumstance, transthyretin is a very important, it's not very important in its function, but it performs a function regardless. It helps in the distribution of thyroxine. It also helps in the distribution of vitamin A. However, this protein, which in its native state is a tetramer, as you can see, we have 4 colors representing the tetramer, and we also have a small perforation at the center, which is the location where it binds to thyroxine, where thyroxine binds. We call it the T4 binding site. Under normal physiological circumstance, transthyretin is a tetramer. But the tetramer, as we become older and our internal system becomes high in its oxidative burden, transthyretin adapts the tendency, becomes more prone to dissociate from its tetrameric form. It can change into, it can dissociate to release its monomer. While the tetramer is stable, the monomer is not. And the monomer has a likelihood to become misfolded and then forms the toxic aggregate. So once the aggregates are formed, the aggregates have the propensity to attack normal cells in the heart, in the central nervous system, in the liver, in the kidneys. And these proteins accumulate and results in organ dysfunction, which ultimately can lead to death. Both the misfolded oligomers and the mature fibres are capable of inducing cytotoxicity. So please, the next slide. So what are the strategies that have been developed over the years to help to reduce the chances of transthyretin amyloidosis? What are the strategies that have been adopted to slow down the progression of this neurodegenerative disease? So one of the first strategy is to stop the production of transthyretin from the liver. So in this case, we have what we call TTR suppression. That's the name of the strategy. And right now in the market, we have some agents, some drug candidates like inotersen, which help to prevent their small interfering RNAs that help to prevent the production, the synthesis of transthyretin from the liver, because transthyretin is not an essential protein, so to say. So even if we can reduce the synthesis, it's not going to cause any remarkable or substantial physiological changes. So one strategy is to stop their production. A second strategy is to help to stabilize the tetramer. We call that tetramer stabilizers. So if we can stabilize the tetramer and prevent it from dissociating, then the propensity of becoming misfolded and aggregating and producing the toxic fibers and oligomers reduces drastically. A third strategy is to trigger what we call an off-pathway mechanism, whereby even though the monomer is dissociated, we have small molecules that we can use to attach to the native monomer or misfolded oligomers. And by attaching these molecules to these protein precursors, we can remove them from the normal pathologic pathway and divert them into a non-toxic pathway. So then the third strategy here is the fourth strategy here is to attack the fibrils, the mature fibrils. We call this strategy fibril disruption. So if we can help to disrupt the mature fibrils, then we can reduce the cytotoxicity that is caused during transthyretin amyloidosis. So please, next slide. So then, how do we get into this point where we want to see if we can use medicinal plants to tackle transthyretin amyloidosis? I will share you a story, what I used to call my centella asiatica story. You know, several years, precisely 2012, I was still in Nigeria, and I had the opportunity of visiting one of my professors. We used to call him Baba. So I went to his office and we were chatting. All of a sudden, he introduced a product to me. He said, Eze, you have to try this. And I was like, what do you mean, Baba? He said, this is very good for the brain. It can help to improve your memory, it can stimulate memory, it can help retention. When you study something, you will not forget it. And that sounds very, very interesting to me. And so I asked him, Baba, what is this? He said, it is centella asiatica. I said, I've never heard of this. He said, yes, I got it from India when I went for a conference. So you see, my centella story actually began in India. And here I'm presenting to you in India. So I got interested After that discussion, I got interested in Centella asiatica and another plant which he also introduced to me, Bacopa monnieri, which he also got from India. This was in Nigeria. So several years later, about 6 years ago, when I came to Thailand, I was engaged in a research project on neurodegeneration, focusing on this particular ailment, transthyretin amyloidosis. I went ahead and proposed 5 plants that can be used to tackle transthyretin, that could be used to tackle transthyretin amyloidosis. Fortunately, 2 of the plants that were approved were Centella asiatica and Bacopa monnieri, the plants which Baba introduced to me. So I was so excited, and we got into extraction. We extracted Centella. Before I go into I would like to even give you a brief overview of Centella. It is a plant that is widely common in Asia, just as the name sounds, asiatica. In Thailand, you can find it in almost every local market in the southern part of Thailand. They drink it as freshly prepared juice. They use it in preparing pastries. They put it alongside rice when they are eating it. It is so ubiquitous that if you go to the market, it's so cheap, you can have it anyhow you want it. So it's a common plant that grows in marshy areas and in temperate regions. We didn't have it in Nigeria until Baba introduced it to Nigeria. It's not native, it is native rather in Asia here. So we got into the extraction process where I fractionated the Centella asiatica. I was interested, I wanted to know if Centella will have any effect on transthyretin amyloidosis. So after fractionating it using simple solvent fractionation, I produced about 4 different fractions. I then profile the 4 fractions on the tetramer, the transthyretin tetramer, to see if they could stabilize the transthyretin tetramer. Please, the next slide. So if you look at the figure which you have in front of you, on the SDS gel in your right hand, you'll see that the last lane is the lane that contains the Centella asiatica active fraction. We had 4 fractions. One of the 4 fractions was active. So the last lane contained the active fraction. You could see that the tetramer, the band produced by the tetramer, is thicker, is more intense in its appearance than the closest band, that's the third band. If you look at the third band is a little bit lighter compared to the last band, which shows that you had more tetramer in the last band, which contains our extract, than in the third band, which did not contain our extract. The first band, no, the second band is the control band, which did not contain the stressor, which in this case was urea, which we used to cause tetramer destabilization. So you see that there was no tetramer destabilization here. That's in the second band. But in the third band contained the destabilizer. And you see that a lot of the tetramer were released. And you could also see the corresponding increase in the intensity of the bands produced by the monomers. Then the last lane contains our Centella bioactive fraction. And you could also observe that in this case, the intensity of the tetrameric band was higher. And we then decided to see how Centella bioactive fraction affected the morphology of the protein using transmission electron microscopy. So the image on the right-hand side is the TEM micrograph. And from it, you see that A is the control, which does not contain anything, no stressor, no Centella extract. You see that the proteins are well dispersed and solubilized, and they don't have any aggregates. Then B contains the centella and the protein. And you can see that in the presence of centella, the protein still forms some aggregates. Now, in the C part of the figure, you see that even though centella, the C part does not contain centella, and you can see that there was a mature fibril that was formed. Unlike in the B, where we only had aggregates and we didn't see any mature fibril. In the C part, we had mature fibril. And the D is just a higher magnification of that mature fibril. So please, next slide. So from this, we quantified, and we also use subsequent techniques like cross-linking, glutaraldehyde chemical cross-linking, ANS probe to determine the binding of the centella asiatica bioactive. So from there, we realized that that centella asiatica bioactives were able to bind to the tetramer binding site, to the thyroxine binding site. When normally thyroxine binds, we discover that our centella bioactive fraction, the components there, were able to bind at that thyroxine binding site. And by binding to the thyroxine binding site, they were able to increase the tetramer stability of transthyretin by as much as 52%. And because of that, the rate at which the tetramer is able to dissociate subsequently reduced. And that reduction, we surmise, could help to retard the progression of transthyretin amyloidosis. So that was what we were able to take out from this research with centella asiatica, that the bioactive fraction from centella asiatica was able to bind at the thyroxine binding site of the transthyretin tetramer and increase its stability, prevented its dissociation, and inhibited the progression in the amyloidogenic pathway. So that was what we concluded from this. And based on the encouraging results that we had from the centella asiatica, we decided to also test another plant, which Baba suggested to me several years ago. In this case, it was Bacopa moneri. Please, next slide. So Bacopa moneri also is a small plant that is very common in Asia. In India, it's called Brahmi. In Thailand, they call it Promi. And it is widely reputed. Many people know it as one of the herbs that is used for combating neurodegenerative diseases, especially Alzheimer's disease. It's a very, very popular plant in these regards for combating neurodegenerative diseases. Also, some people use it as a nervine to relieve nerve stress. So what we did was we followed the same protocol that we use for centella asiatica. We produce our bioactive fractions, and after producing the bioactive, we fractionated. We extracted, then fractionated, then screened for the bioactive fraction from Bacopa moneri. But in this case, we decided to see the effect of Bacopa moneri on two types of transthyretin, because we have the normal white type human transthyretin, and also we have the mutated form of human transthyretin. And the reason we did this was because the mutated form of human transthyretin is more aggressive in its pathogenicity. So we wanted to see if components from the extract of Bacopa moneri could help to reduce or even prevent the progression of transthyretin dissociation. Please, next slide. So using our stability experiments, we were able to establish that the bioactive fraction for Bacopa monnieri was able to increase the tetramer stability of both the wild type and the mutated type transthyretin. And in the case of the wild type human transthyretin, Bacopa monnieri enhanced the tetramer stability by 44.2%. But it didn't only enhance the tetramer stability. We discover also that in the presence of Bacopa monnieri, the formation of mature fibrils and oligomers were also impeded, which was quite remarkable because in the case of Centella asiatica, we discovered that the bioactive fraction from Centella was only able to stabilize the protein, but it didn't prevent the formation of the amyloid fibrils. Once the protein dissociates, it ended up forming fibrils. But in the case of Bacopa monnieri extract, we realize that even when the protein is able to dissociate in the presence of Bacopa, the subsequent stages were also impeded. Please, the next slide. And that result was quite encouraging for us. And based on what we saw with Bacopa monnieri and Centella asiatica, and the higher amount of tetramer stabilization that we observed when we used Centella asiatica bioactives, we decided to see if we can identify the active ingredients, the different metabolites that were present, bioactive metabolites that were present in these extracts. So that the idea was to see if we can even raise up the effectiveness beyond what we observed. So in the case of Centella, we used LCMS to profile the compounds that were present, and compounds such as chlorogenic acid, acetoicoside, madecassoside have not been investigated. There were no reports on their anti-amyloidogenic effects when it comes to transthyretin. Also, Centella contained other compounds such as catechin and quercetin and apigenin, but those compounds had already been reported to have some effects, some therapeutic effects on transthyretin. So we decided to look at the compounds that had not been reported, but which were also majorly present in Centella. So what we observed was that these compounds didn't have any substantial effect on transthyretin amyloidosis. That's the newly identified compounds such as chlorogenic acid, acetoicoside, madecassoside. They did not have as much, they didn't even have any significant effect compared to the extract. And that to us was a little bit interesting and unexpected until I stumbled on an article that was also published almost the same time by Chaudhry et al., where in their own case, they use extracts from Juglans manchurica, which is a plant common in Japan. And the methanolic extracts were fractionated to give butanol extract and ethyl acetate extract. These extracts, they discovered that the extracts from the fractions from Juglans were able to inhibit, not inhibit, they were able to dissociate the mature fibrils and thus reduce the cytotoxicity. And because of that positive result, they also wanted to identify the compounds that were present in Juglans manchurica. After realizing that most of the compounds were naphthaquinones. They elucidated the naphthaquinones that were present in jugular mandurica, and then tried to see if those compounds, those naphthaquinones were able to inhibit, to disrupt the mature fibrils. And they had the same observation. They realized that the naphthaquinones that they identified in their bioactive fractions did not have any effect on transthyretin. Then they now decided to look at other species of jugulans and other compounds. And finally, they were able to identify one particular naphthaquinone in a different species of jugulan. And that naphthaquinone was called juglone. Juglone was able to disrupt the mature fibrils. But at the same time, they observed something. They realized that juglone was also cytotoxic to normal cells. It could disrupt the mature fibrils in vitro, but when you introduce it into normal cells such as human epithelial kidney cells 293, they discovered that the juglone was cytotoxic. So what's the relevance of these observations? The point is sometimes, please, the next slide. The relevance here is sometimes we could observe a particular effect from an extract and then isolate the compounds and not have the same effect, because there are some things that also come into play when we use extract, which are not available when we use a purified compound, such as synergistic activity, such as additive effects, such as the ability of one compound to modulate the effect of other compounds. And at this point, if our interest is therapeutic efficacy, if we want to have the maximum therapeutic effects and drug effects, then we may not necessarily have to isolate a particular compound. We can do what has been a common knowledge in traditional medicine for centuries and millennia, which is we can enrich the extract to give us more of the fraction, more components in the fraction that is active to improve the therapeutic efficacy. So then, why is it important to isolate? Some people will ask. Yeah, there are benefits for isolation. It is through isolation that sometimes we identify the particular compound, because in some cases it is one compound that is producing most of the effect. Isolation gives us that. But with the advance in technology now that we have LCMS, we have MSMS, we have high resolution equipment to not just characterize and elucidate even the components in our extract, but also to sometimes even identify the particular group of compounds. In that case, we may not even have to isolate. But in the case where it is just one compound that is responsible for most of the bioactive effects, isolation gives us the advantage that that compound can now be produced using synthetic pathways. So we don't have to go back and start isolating it from natural sources. We can use synthetic pathways to isolate that compound. Isolation and structural elucidation also gives us the avail us with the opportunity to discover new structural scaffolds that we can also use in drug development. That is important. But still on amyloidosis, I want to present a work that in a way contrasts what we observe in the case of Centella and in the case of Bacopa Moneri, which was in a recent work that was published in ACS Neuroscience on Rosa damascena. So this plant is common in the Middle East and also in Africa. We see it obviously as rose flowers. That's the way most people see it. And in the Middle East, it's used for occasions, it's used for spices, it's even used for food as spices, and it's used in perfumes. So the flowers of rose is rich in phenolic glycosides. So this research group wanted to see if the extract from those flowers, the methanolic extract from those flowers, had any effect on alpha-synuclein, which is the protein that is responsible for Parkinson's disease. When alpha-synuclein aggregates, it causes Parkinson's disease. So they wanted to see if the methanolic extract will have any effect. And yes, indeed, the methanolic extract from Rosa damascena, it did not prevent the aggregation of alpha-synuclein, but what it did was it bound to the alpha-synuclein and took it off the amyloidogenic pathway. It made the oligomers that were formed from alpha-synuclein to be less toxic than otherwise would have been. Because of that result which they observed, they decided to identify the metabolites that were present in that bioactive fraction. And they realized that the compounds there were gallic acid, camphorol glycoside, camphorol 3-O, beta-rutinoside, and quercetin. Now, I will stop there. You see, these compounds are compounds that even by the time I started my research, about 6 years ago, I already knew that these compounds had anti-amyloidogenic effect. You see? So you don't need to isolate these compounds. They are available in the market. You don't need to isolate them from rose. But here is the relevance of this research. It's not particularly about the isolation. The relevance here is that they were able to establish that extracts from rose flowers could ameliorate or at least reduce Parkinson's disease, which is a devastating neuromuscular condition. And because rose is easily found in many parts of the world, even in poor countries, this gives us the opportunity of using this as a natural medicine, as an alternative. Not entirely, but we can use it to complement as an adjuvant, to supplement what we get from conventional treatment. So that was the relevance, that we can now deploy extracts from rose for combating Parkinson's disease at the population level. Please, next slide. So after being able to establish that Centella asiatica had positive effects on transthyretin amyloidosis, at that point, I was also seeing some research showing that Centella asiatica had some beneficial effects on diabetes. I wanted to see if I was interested in whether Centella asiatica had the ability to inhibit the formation of advanced glycation end products. What are generally known as AGEs? What are AGEs? These are complex molecules which are produced in our body under physiological conditions, but they are accelerated during the production of, during hyperglycemic condition. They are accelerated, and they have the ability to accelerate the degeneration and complication that we often see in type 2 diabetes. So it has been recommended that one way of combating that we can help to reduce the symptoms and the morbidity in type 2 diabetes is by combating and preventing the formation of advanced glycation end product. So what I did in this research was, I was able to prepare a phenolic-rich extract using a method that we recently developed in our lab. So by enriching the phenolics from Centella asiatica and using bovine serum albumin as our model of glycation, we discovered that in the presence of Centella asiatica, the formation of fluorescent advanced glycation products were drastically reduced. And the formation of protein oxidation products, such as dityrosine and N-formyl kynurenine, were also substantially reduced. See, these products of protein oxidation are not just detrimental and implicated in the progression of diseases such as diabetes, obviously, but we also see them in other degenerative conditions such as in cancers. We also see them in cardiovascular diseases. We also see them in neurodegenerative diseases such as Alzheimer's and Parkinson. So the fact that the phenolic-rich extracts from Centella was able to reduce this, not just the advanced glycation products, but also the oxidation, the protein oxidation that comes with the formation of advanced glycation product. We realized that Centella extract could be relevant in reducing the effects of oxidative stress. And when we profile the Centella asiatica, we realized that it was basically the antioxidant and the anti-radical activities from Centella that was responsible for the anti-glycation and the anti-protein oxidation effects. So at this point, I want to round up, which is, today there's always, as a scientist in a discipline related to phytochemistry, we are always faced with the choice of whether to isolate after we have profiled for bioactivity. Here is what my little experience has shown me over the years. Sometimes it's relevant to isolate, especially if we are interested in identification of novel bioactive scaffolds, novel structures which we can use for synthetic chemistry. If we want to produce new drugs, if we want to have new drug candidates, sometimes we need to isolate. But if our interest is more related to therapeutic efficacy of the extract which we have profiled, then enrichment of the bioactive extract may be a better approach, especially given that today we have the tools to make that happen. We have supercritical free extraction, we have subcritical extraction methodologies, which can help to improve the bioactive component in an extract in remarkable levels. We have different extraction approach, green extraction approaches, which we can also employ to improve the bioactive component in any extract. And to top onto that, we also have the advanced tools which could help for the structural elucidation of the bioactive component without necessarily isolating the individual compounds. Today, we can use LCMS to identify the compounds that are present in our bioactive enriched extracts. And we can even quantify them. We can quantify the individual components, individual compounds in the extract using LCMS, using NMR. So indeed, we are in a new era for the application of traditional medicine in combating neurodegenerative diseases. Last slide. And so with that, I'll bring my talk to a conclusion. Thank you for having me. And I want to extend my deep appreciation to Dr. Yogesh for extending this invitation to me. Thanks to everyone who has joined us